Okay, so good afternoon, everyone. My name is John, and I'm one of the pharmacists here at NKS Health. Today, I'll be going over with you some of the tips and advice on how to successfully quit smoking. Before I begin my presentation, I would like to briefly introduce myself. I've graduated from University of Waterloo with a degree in Doctor of Pharmacy, and I've come from a variety of working experience in both community and clinical settings. I've worked at Walmart, Shoppers Drug Mart, and Loblaws in community settings. And I've also worked at Toronto East General Hospital for my clinical setting. Working in these different environments, I've come to interact with many different patients of a variety of health conditions. And I realized that, lifestyle changes are one of the most important changes that you can really make to optimize your health. And of course, smoking cessation is one of them. And smoking poses a lot of risk to our health. We all know that smoking is very bad, but we don't really understand to what extent. I'll show you guys some statistics that I've pulled from Centers for Disease Control and Prevention and Heart American Association. So approximately 1 out of 2 long-term smokers will die from complications of smoking, whether it be lung cancer, heart disease, or respiratory disease such as COPD. And 1 cigarette cuts about 5 minutes of your time. And so if you were to put things into perspective here, if you smoke 1 pack a day, which contains about 20 cigarettes, that's about 2 hours of your life in a day that you're cutting. In a week, that's half a day, and stretch this out to even further. In a year, that's about 26 precious days that you're losing because of smoking. And so what is it about smoking that's so bad? Well, smoking contains about 4,000 toxic chemicals, of which 70 of them are carcinogenic or cancer-causing. And so this information itself should really make you want to quit smoking. But if you're not convinced yet, let me just show you some of the benefits of quitting smoking. So, smoking has a huge impact on your heart. When you inhale cigarettes, it constricts your blood vessels by causing your blood pressure to shoot up, and it overworks your heart. Not only that, it lowers your good cholesterol in your body, known as HDL, and that increases your risk of forming blood clots in your heart arteries. And these all lead to an increased risk of heart attacks and strokes. Quitting smoking is also shown to lower your risk of cancers. There's a lot of misconception out there saying that smoking will only increase your risk of lung cancer. That's actually not true. Lung cancer is not the only cancer that smoking can cause. Smoking is associated with, also stomach cancer, pancreatic, kidney, esophageal, and the list goes on and on. Quitting smoking also lowers your risk and severity of autoimmune conditions. Heavy and chronic smoking has shown to weaken our immune system while increasing the amount of inflammatory response in our body that are strongly associated with rheumatoid arthritis, ankylosing spondylitis, and multiple sclerosis and other autoimmune conditions. Using rheumatoid arthritis as an example, heavy chronic smoking has shown to increase the likelihood of you acquiring rheumatoid arthritis up to 100%. So as you can see, the risk is very high. And not only that, smoking also reduces the effectiveness of medications that are used to treat these symptoms, these conditions. These medications are called DMARDs, disease-modifying anti-rheumatic medications, or there's other biologics such as anti-TNFs. Studies have shown that smokers compared to non-smokers are often on higher doses of these medications because their disease severity are often a lot worse and harder to control compared to non-smokers. And so you can see here, smoking is really, really, important, and it's one of the best things that you can do to really control your rheumatoid arthritis and to really reduce the chances of this disease exacerbating. Besides that, there's many more benefits. It lowers your risk of diabetes, it lowers your risk of osteoporosis, hip fractures. We all know that smoking can cause more bone loss and hip fractures, especially in women. It lowers your risk of reproductive disorders. There's a lot of complications, especially if women are planning to become pregnant. They should never smoke. It lowers your risk of ulcers, especially in your mouth and stomach. Smoking also improves your dental health, lowers your risk of gingivitis and other dental infections as well. So next, I wanted to talk about why smoking is so addictive. Well, along with these, 4,000 toxic chemicals and carcinogenic substances, cigarettes also contain what's called nicotine. It's a very highly addictive substance that, when inhaled, travels very rapidly from your body to your brain in about 7 to 15 seconds. And nicotine has an effect on this specific part of the brain called mesolimbic pathway that's responsible for controlling addiction and dependence of substances. And this is the reason why many find smoking to be very enjoyable. Besides that, nicotine also gives that temporary feeling of relaxation and pleasure, which is why often people will turn to cigarettes when they're under high stress or when they're in a very anxious environment. And looking at it from a pharmacokinetic perspective, which is how drug is distributed in your body, nicotine has a very short half-life, about an hour to an hour and a half, meaning your body starts to show signs of nicotine withdrawal in that time period within about an hour. And that results in cravings, and this vicious cycle of dependency just goes on and on. So what is our goals of quitting smoking today? Well, first of all, we want to help you reduce and eliminate cravings of smoking completely. However, we do need to understand that quitting smoking is a gradual process that does take some time. And quitting cold turkey is a very difficult process, and uh, it's really important that you need to understand that we need to aim to reduce the number of cigarettes consumed per day if cessation is not possible. But ultimately, our goal here is to, over the course of a few weeks to few months, it's to stop smoking completely. And in doing so, you need to really understand that engaging in a healthier lifestyle will help increase your risk, your likelihood of you quitting smoking. So next, I wanted to talk to you guys about treatment options that are available. For those who smoke more than 10 cigarettes per day, pharmacological therapy is more effective than non-pharmacological options. Um, Nicotine replacement therapy is often the first line of treatment for most patients due to the ease of accessibility and long-term safety record. They're very easy to uh, to buy from a local pharmacy store, and they have a very long-term safety data on it. Nicotine replacement therapy has actually shown to increase the rate of quitting smoking by about 50 to 70%. So that's about 7 out of 10 patients that will succeed in quitting smoking if they use nicotine replacement therapy. The way how it works is it supplies the small amount of nicotine to your body by means other than smoking, and that really helps to ease withdrawal and cravings of cigarettes. And it does come in different forms. It comes in a patch. It comes also as gums and lozenges as well, and inhalers, which are more used for breakthrough cravings. So what we have here is a nicotine patch, also known as Nicoderm. They come in 3 different strengths, 7 milligrams, 14 milligrams, and 21 milligrams. And you're looking at to use the nicotine patch more as a more of a long-term rather than these breakthrough cravings. And so if you're to smoke less than 10 cigarettes a day, you'll start off at a 14 milligram patch once a day for 6 weeks, and then you'll go on to 7 milligrams once daily for 2 weeks. If you smoke more than 10 cigarettes a day, you'll go on 21 milligram once daily for 6 weeks, and then 14 milligrams once daily for 2 weeks, and then taper down even further to 7 milligrams once daily for 2 weeks. These patches are usually just once daily patches, so you can use it fully for 24 hours and then replace the patch, or you can take the patch off at night and replace it the next day. And the patches should be always applied to a clean, dry, non-hairy area. The goal here with these patches is to quit smoking in about 8 to 12 weeks. Next, we have here are nicotine gums and lozenges, which are used more for breakthrough cravings. It comes in a 2 different strength, 2 milligrams and 4 milligrams. 2 milligrams are more for lighter smokers who smoke less than 20 cigarettes per day. And it's also for those with less cravings and less nicotine withdrawal symptoms. 4 milligrams are more for heavier smokers who smoke more than 10 cigarettes a day. If you're using the nicotine gum, you should avoid drinking acidic beverages such as coffee, fruit juices, or soft drinks, or alcohol, especially while you're chewing, and 15 minutes before you start chewing these gums, because it can decrease the absorption of nicotine if you have any acidic drinks. And it shouldn't be chewed like a regular gum. It can cause nicotine toxicity, which is nausea, upset stomach, mouth and throat, and gum irritations, and headaches, and increased heartbeats. These nicotine gums should be chewed slowly until you can taste the nicotine, which is sort of like a peppery taste, or have that light tingling sensation in your mouth. It usually occurs after about 15 to 30 chews. What you want to do here is then stop chewing and park the gum in the pocket of your cheek until that tingling sensation is gone. Occurs after about 1 minute after you park. And you want to start chewing again and just repeat this process for about half an hour. Keep in mind that there shouldn't be any issues with you using these nicotine gums or lozenges while you're on nicotine patch. In terms of cost, you're looking at about $10 to $20 per week. Next, we have here are nicotine inhalers, also known as Nicorettes. Um, it's often used for breakthrough, and it's very useful for those who have that habit of hand-to-mouth gesture. Um, Again, it comes in a 10 milligram cartridge that contains about 4 milligrams of nicotine, and each cartridge should last you about 20 minutes. However, I do want to let you know that it's a bit more expensive than the gums or lozenges. You're looking at about $40 a week. Next, we have here are prescription medications. These are good options for those who have been unsuccessful with the nicotine replacement therapy. Currently in Canada, there are 2 prescription medications that are indicated for smoking cessation. The first one's called bupropion, and the second one's called varenicline, also known as Champix. Make sure to consult with a physician or a pharmacist if you're deciding to try these options. And it's always important to note that with these prescription medications, you want to begin about 1 to 2 weeks before the quit dates. First one we have here is called varenicline, also known as Champix. It is a nicotine-free pill that you take for 3 months. The idea here with this medication is to sort of mimic the effect of nicotine by stimulating these nicotine receptors in your brain and your body to reduce that cravings and withdrawal symptoms. For the dose, it's given as a 0.5 milligram once daily for 3 days, and then you're going to taper it up to 0.5 milligrams twice daily for 4 days. Then you want to even increase it further to about 0.5 milligrams to 1 milligrams twice daily for 12 weeks. Please note that you don't take nicotine replacement therapy. You can't take nicotine replacement therapy concurrently with these medications, and the reason being there just aren't any long-term safety or efficacy data to support the combination. In terms of side effects, the most common side effects that you may experience while you're on Champix is feeling a bit nauseous, and this can be mitigated by taking Champix with full glass of water on a full stomach. Some have noted that sleeping can be a problem, which it can cause uh, insomnia, and if that's the case, you want to take your second dose closer to your supper time or even earlier. Some of the more serious side effects include suicidal ideation or even mood or behavioral changes. If you do experience these side effects, please seek medical help or consult your physician immediately. Next one we have here is called bupropion, also known as Zyban. It's another prescription medication that's indicated for smoking, but also for depression as well. So this medication may be more useful for those who are undergoing depression, who are also trying to quit smoking. Again, it is a nicotine-free pill, and it works by blocking these chemicals in your body that stimulate cravings and dependency on cigarettes. The standard dose for smoking cessation is 150 milligrams once daily for 3 days, and then you want to taper it up to take 150 milligrams twice daily for about 7 to 12 weeks. Okay, there isn't any problems with this one in terms of combining with nicotine replacement therapy. So you can combine these two together, and in fact, studies have shown that combining nicotine replacement therapy with bupropion is more effective than the monotherapy alone. And again, in terms of the cost, it is uh, much cheaper than the Champix. Some of the contraindications, it's not recommended for patients that have a history of seizures, eating disorder, or liver impairment. And while you're on bupropion, it's important to avoid drinking alcohol as it can cause liver damage. And please consult, physician or pharmacist if you're using any other prescription medications, especially antidepressants, as bupropion does also act as an antidepressant. And this is something that you need to take every day to see the benefit. Bupropion shouldn't be something that you take for breakthrough or for just as needed basis. It's something that you need to take for every day for at least 3 to 4 weeks to see the benefit. Some of the common side effects that you may experience include dry mouth, insomnia, dizziness, weight loss, tremor. And if you notice some severe side effects such as suicidal ideation, seizure activities, or unusual behavioral changes, this requires immediate medical attention. It's actually shown that the best odds of quitting smoking is if non-pharmacological options are combined with pharmacological options, as I've previously mentioned. It's really important to note that quitting smoking is not a singular event. It is a gradual process that requires, your commitments, your motivation, and realistic timeline. Avoiding triggers, are certainly a great way to help reduce that, reduce your chances of quitting smoking. Sorry, increase your chance of quitting smoking. Especially avoiding a time when you will be under stress. Keeping a positive attitude and thinking of why you really want to quit and all the good things that will come of quitting smoking. I do want to, it is possible that you may gain weight while quitting, and you can avoid this by, eating healthy foods, increasing the amount of your daily activity, keeping healthy snacks around you for times when you have the urge to nibble, and keeping it busy, with healthy activities like walking or exercise programs is a great way. Starting a new activity will definitely help you break the old habits that are connected with smoking. Um, and it's really important to decide what support will be most useful for you over the next couple of months. For example, you can speak with your pharmacist, who can now prescribe smoking cessation medications, and there's always your family physician that's available for you as well. You can tell your family friends that you're quitting, and you can ask them to help you stick with your plan. If they smoke, ask them to please, respect your decision to quit and not smoke around you. Think of the things that you can really do to try to avoid smoking while you're with them. I do want to list some of the resources that I have here. Center for Addiction and Mental Health, CAMH, has a program called the STOP program. It's a comprehensive a program that distributes this free nicotine replacement therapy to smokers across Ontario who are interested in making a quit attempt. So this is definitely useful for those who can't afford a nicotine replacement therapy. There's also a free service called Smokers Helpline. It's a great resource which is operated by Canadian Cancer Society that offers web support and information about quitting smoking and its use on tobacco. So please feel free to use these resources. And again, if you have any need more information about quitting, you can always ask us, the NKS Health Pharmacist. Okay, so that was the end of my presentation, and I'll open the floor up to any questions.